I got nervous.
Okay, everybody, welcome. Good morning to the OMHA Health Alliance quarterly meeting. My name is Jenna Sistad, and I am the project manager. I am joined here by Diana Rios, who is an extension of our coalition overseeing the Health Equity Response Grant, covering all things COVID. Unfortunately, this morning, our bilingual community health worker, Marlene Alvarado, couldn't join us, but we wish her well. And I know many of you know her. If you haven't gotten the chance to meet her, I hope you will in the coming quarter. I'm going to share my screen so that we can see the agenda together. Can everybody see the agenda? All right, so as I said, this is our quarterly meeting. I can't believe it's our last quarterly meeting for 2022. Seems crazy to think that, right? But here we are. We do have some dates outlined already for the next year for this meeting, which will happen 4 times. And Diana's going to talk with us a little bit about what that looks like a little later in the agenda. But for now, I'd just like to welcome you and take you through some upcoming events that OMHA Health Alliance has happening with ourselves and some great partners. So let me see if I can get the first one up is our You Are Key to HPV Cancer Prevention. So this is a collaboration that we're doing with our SEED team and the Asbury Park Public Library. It's actually this Saturday, November 5th, 10 a.m. to 12 p.m. What this is some education that SEED will be providing about HPV and how it affects both boys and girls, talking us through some screening opportunities that are available to you and in your community. And it also is going to be a screening where we're showing a movie that follows the lives of 5 girls that have an HPV diagnosis. So it's going to be a great event. Right now, we're seeing low attendance. So there is a chance that this is going to be rescheduled. And if that's the case, we're going to reschedule to probably after the holidays, because we know it's a busy time for folks. So help us to please get the word out about this event. You see the Eventbrite link there and the QR code. That's how you register. And light breakfast will be served. See how I can move this. Aha, great. All right, so the next thing on our agenda is to talk about our health equity and lung cancer prevention in the LGBTQ plus community. This is a series that we're doing with the SEED team as well as Rutgers Cancer Institute of New Jersey. It was a 2-part series, one including breast cancer for October, because we know Breast Cancer Awareness Month is celebrated then. And the next one will be this month on November 16th, 4:30 p.m. You see the QR code there, and that would be how you register for this one. The first one was a really great presentation by Ashley Perper, and we love the message, and we know the next one will be just as great, focusing on lung cancer prevention. So join us if you can. The next one. Our turkey smoke out. So we all know that Lung Cancer Awareness Month is this month, November, right? And so we're trying to help people get access to quit services and smoking cessation programs. We have lots of great partners who are with us today on this meeting who offer these types of programs. And so what we've decided to do is come together with some partners and do a turkey smoke out event at the Freehold Family Health Center on November 17th from 10 to 1. This will be an in-person event right at the health center. So if you haven't been there yet, it's an amazing establishment and it offers a variety of different preventive, primary care, and specialty services. So in addition to the quit services that we'll be offering, you can get a sneak peek at the health center itself. And not just that, but in addition to the Thanksgiving holiday, we are offering through Fulfill 1 free turkey for the first 100 participants. And then some of our wonderful health insurance partners have decided that they'll help us by donating the trimmings for Thanksgiving dinner. So if you're able to join us for that, great. We'd love to see you out. And if not, please help us to share this with other families. Okay, and then finally, the last event that we have that I will share is something that's happening in 2023. It's something that we're offering twice on January 12th with the RWJ Barnabas team of docs, as well as our SEED team. It's survivorship and cancer care. And so what this is an effort that came from our DOH objectives. This is something new that they've outlined for us this year. They want us to be working with primary care practices to help them better understand the needs of survivors through the survivorship journey in a primary care setting, right? So people are working with their oncology team when they get the diagnosis, but if they are afterwards or throughout the survivorship journey working with their primary care team, is that team equipped to know what a survivor's needs are? And so we'll be talking about things like screening follow-up recommendations, genetics, long-term side effect medication management, and rehab practices. So this is led by Dr. Megel, and they are recruiting a couple of other docs that specialize in these topics that I just mentioned. And it will be a great talk. So we hope that if you have interest in this, please join us. If you know primary care teams that are interested in this, please feel free to share it with them. We're offering an afternoon and an evening session for this as well. I'm going to stop and ask, does anybody have questions at this time about any of the events that we mentioned, or any of the partners would like to add anything about that maybe I missed about any of the events that I just said?
No questions, but I think you're doing great.
Thanks, Diana. Okay, let's see, where are we at now? Next thing on the agenda, okay, is to talk about 2023 goals. Again, I can't believe we're talking about 2023 already, but we are. So part of what I just mentioned with the January 12th event is really heightening awareness about what survivorship care plans are and how we can help people use them in the community, whether we are educating the primary care practices or educating the survivors themselves on what this care plan is and how they can utilize it, how they can advocate for themselves when working with their non-specialty docs, to make sure that they are following their wellness care plans. So more information to come on that. If there's anybody here who'd like to collaborate on any type of initiative related to survivorship and care plans, please let us know. We're totally open to that. And then the other goal that we have outlined for our 2023 is more collaborative approaches, right? So you see a lot of events and different things coming out from the coalition. And it's great, and we love to, host things and partner, and, we'll drag the SEED team along with us and say, come on, let's do this, or maybe another partner here or there. But really what we'd love to see is many of the folks here that are part of some really great networks, whether it be a hospital system or a cancer center or, a support service organization. We'd love to see all of these folks come together and really plan something meaningful together. Now, maybe it doesn't have to be every month or every quarter, but maybe once a year we could all come together and put something together for the community. And so I think a little bit later, we're going to hear from Dan Pearson. He's going to talk us through the cancer burden data in our region, and maybe that could give us some ideas of things that are needed in the community. And if you have interest in doing any of this with us, planning an event, a conference, a series of any kind, just let us know. We're happy to do it together. And a great example of this was our Wellness Rocks event. Many of you that were on the call now were either helping us to plan and or implement these events. And I think that was a really nice way to showcase that when the partners come together, we can have such a bigger impact on the community. If it's just one or two of us, but when, 5, 10, 15, there were, I think, close to or over 20 exhibitors at the Lakewood Wellness Rocks. When we do it together, there's a larger impact in the community. So looking forward to doing more of that kind of thing in 2023. Okay. All right. I'm going to pull up the quarterly meeting schedule for 2023, and I'm going to pass it to Diana. She's going to talk with us a little bit about that.
Hi, everyone. I just want to share our quarterly meeting that have been scheduled for next year. The next one after this one, after our nice Christmas and holiday break, will be February 8th at 10:30. And of course, there's the Zoom link. And then we have the May 10th, moving forward in August 9th, and of course, November 8th. Let's see.
I'm going to grab, I'm going to grab you see it here, the date and the link as Diana's talking.
Señora, buenas tardes, buenos días, le estoy llamando al programa de WIC. Usted mandó su foto ID y su prueba de embarazo, pero no mandó el ingreso de la familia. Trabaja en casa.
Yeah, I think you have to mute her. Can you mute her, Jenna?
Oh, sure. I wasn't sure if this was a question.
No, she's actually on the phone with a client, I should say, not customer.
Okay. All right. Actually, that brings about a good point. I can only see like the first 5 or so people who are with us on the meeting today, but is there anybody here who needs Spanish translation?
Let's see. ¿Alguien aquí necesita que le traduzcamos la presentación de hoy? Si necesita, por favor, póngalo en el chat o marque ahí en su pantalla que necesita traducción. Nope, don't see anybody yet.
Okay. All right. So we're going to continue. We're going to move right along. Thank you, Diana, for taking us through the meeting schedule. I did put the next meeting, February 8th, information into the chat. So you could go ahead and throw that on your calendar now and save the date. And this was sent out with the last reminder for today's meeting, but if you need access to it again, just let us know. We're happy to get it over to you. All right, thank you, Diana, for that. I think you're still on for the next 2 agenda items, so I'll leave you to it.
Yes, so today's presentation will be with Daniel Pearson. He is our principal statistician at Rutgers Cancer Institute of NJ. And then also we will be having Natasha participating and providing us the state's Department of Health updates for OMHA, SEED, as well as the health equity response area. And also to go over the grants. And if you all know Natasha, she's our Director of Chronic Disease and Prevention and Health Promotion at the Children Family Health Institute and of VNA. Did I miss anything?
I don't think you missed anything, but Natasha, are you with us? I can't see who's here and who might not be.
Let me see, I'll tell you right now.
I don't see her.
No, I don't see her, not yet.
Okay, all right. That's fine. So Dan, we'd like to welcome you back. You came with us last time in August for this meeting. Your presentation was so well received. We had many people emailing us and side texting us like, this is great, let's do more of this. And so we're just welcoming you back to talk a little bit more about the last presentation and dive deeper into what that was. So welcome, Dan. Thank you.
Thank you, Jenna. Could you just pass screen sharing over?
Yep, you got it. It's all yours.
Thank you. Okay. All right, you see the full screen?
We do, yes.
Excellent, okay. All right, so I'm Daniel Pearson. I'm the principal statistician with the Center for Cancer Health Equity at Rutgers Cancer Institute. We work with the community outreach and engagement team there. So I know we have representatives that are usually on the OMHA call. I think Ashley Perper is here today, who I work with. I've been here in the past, so it's great to be here again and kind of build upon what we talked about at the last quarterly meeting. Now, I know there are some folks that were not on the meeting last time, so I definitely want to just kind of recap what we talked about pretty quickly so that we have time for the more expanded discussion at the end. But we do want to introduce some key terms that are going to be used in today's presentation just to make everybody familiar. So the 2 main ones that we'll talk about are incidence and mortality. So incidence refers to the number of new cases of a disease diagnosed within a time frame. mortality is the number of deaths from a disease in a time frame. And you can scan the page here. I don't want to, read word for word what these other definitions are, but we talk about age-adjusted rates, which are, when an incidence or mortality rate is kind of factoring in the age of a population so as not to, skew numbers higher if a population has older persons who are more susceptible to a disease, specifically cancer today, versus crew rates when age is not considered. So quickly on cancer surveillance, I know we discussed last time, but so we're looking at 5-year cancer incidence rates here by county in New Jersey. So we have the map on the left-hand side, and then we have this kind of plot on the right-hand side that's showing the actual number for the age-adjusted incidence rates for cancers by county. So Ocean and Monmouth County over a 5-year, from the most recent 5-year from 2015 to 2019, had the 4th and 5th highest cancer incidence rates in the state. In the same 5-year span, Ocean County had the 7th highest cancer mortality rate, while Monmouth County had the 13th highest mortality rate. So generally what that means is if we're looking at 4th and 5th highest incidence and then ranking a little bit lower in mortality, that means that generally speaking, cancer outcomes are better in these two counties when we consider some of the southern counties who might fall a little lower in incidence but higher in mortality rate. You can see where you dropped off a little bit if we switch back and forth from slide to slide. So this is single year incidence going back for 10 years from 2010 to 2019. We can see that the statewide incidence has decreased from over 500 to around 480. And this is kind of indicated by that yellow trend line, which is the state of New Jersey. Let me turn my little pointer on here so you can see. So this yellow line here is the state of New Jersey cancer incidence rate. So Ocean and Monmouth County fall above, for the last 10 years pretty consistently. Now, what was striking the last time, and I mentioned it at the last quarterly meeting as well, was that Ocean and Monmouth counties actually had the 1st and 2nd highest cancer incidence rate. You can see at the end here in 2019, they're the top two dots on all the way to the right. So, over a 5-year span, they rank 4th and 5th, but in the latest single year version, they are 1st and 2nd, which is pretty interesting for someone who's looking at this data. In 2019, Ocean County had the highest lung cancer, thyroid cancer, and bladder cancer incidence rates, and was also top 5 for colorectal, melanoma, and oral cancers, while Monmouth County had the highest prostate cancer incidence rate and the 2nd highest rates for female breast cancer and bladder cancers. So bladder cancer seems to be, a bit of a problem area for these two counties. Now for mortality, things are a little bit better. You're not as high above that yellow line as Ocean and Monmouth counties were for incidence rates, but we do see them both still rank a little bit higher for mortality. Actually, last quarter's meeting, the 2018-2019 mortality data had been redacted from the state cancer registry because they noticed a few errors. So we only had up to 2017 last time, where Monmouth County was below the state rate. So we added those extra years on now. They also released 2020. So we can see that Ocean County and Monmouth County now rank above the state for mortality. And lung cancer definitely seems to be an area of concern for Ocean County. We mentioned it has the highest incidence rate in the state for a county, and now we see that it has the 5th highest, the 4th highest now in 2020 lung cancer mortality rate as well. We also broke these down into racial ethnic disparities for Ocean and Monmouth County. So this is Ocean County. These are the top 10 cancers affecting each racial or ethnic subgroup where the data allows. So it gives an idea about which cancers affect which group. Pretty common in our state is the enormous prostate cancer disparity for Black males. And we see this again in Ocean County where, prostate cancer is largely the highest incident cancer for Black or African-American populations in that county. And then melanoma generally will only appear in the top, X cancer list for white non-Hispanic persons in New Jersey. They tend to not affect racial or ethnic minorities as much, but they are generally within the top 5, in almost every county in New Jersey, specifically on the coastal counties like Ocean and Monmouth. Now we're looking at Monmouth County by race ethnicity. Again, we have the top 10 incident cancers by racial or ethnic group. So Hispanic or Latino persons in Monmouth County had higher incidence rates for both prostate and breast cancers. You can see over here on the bottom left-hand side how far ahead those two cancers are above anything else. They also rank higher than the state average for Hispanic or Latino persons in those cancers. We also see thyroid cancer seeming to affect the Black population in Monmouth County, where it's the sixth most common cancer, which is more than Ocean County, where it's not even in the top 10 for that group. And that would be right here on the plot. So this is where we kind of looked a little bit deeper, right? So we looked at the county level data. A lot of that stuff has been publicly available for a long time, but now we have this release of this sub-county level cancer incidence data from CDC and their environmental public health tracking network. So it's really great. It tends to only give you currently this subpopulation data for some of the more incident cancers. So I think they have breast, prostate, lung, and colorectal cancers on there for sub-county level data. So we took a look at this last time and we kind of identified areas of Ocean and Monmouth counties where there was a general across the board, higher incidence rate for specific population areas. And these are broken into 5,000 person population areas. So they're not necessarily broken into census tracts or zip codes or anything like that. They're grouped into 5,000 person areas. A lot of times we'll see that they actually track pretty cleanly with census tracts, as I have some examples later on in the presentation. And this is what those will look like. So we took census tract population data from the US Census and American Community Survey. What I did here was facet these maps. So we have Asian or Pacific Islander on the top left, and then moving clockwise, we have Black or African American, then white down here in the bottom right, and then Hispanic or Latino on the bottom left. So when we look at these maps, we can get a larger picture of what the population percentages look like for these census tracts. So for darker areas, that means there is a higher percentage of that specific population within that census tract, and the lighter areas mean that there's less. So our scale here starts about 20 goes to 100, but the really light areas can be anywhere from 15 to 0% for the most part. So we'll zoom in a little on those maps as we kind of examine those high cancer areas, but this is kind of an expanded picture of mostly Monmouth County. You can see a little bit of Ocean County with Lakewood at the bottom there, but it couldn't really just fit the way the way the image was spit out. So we'll take a look at those problem areas now. So we highlighted 3 areas last quarter. The first was this area kind of on the northern coast of Monmouth County, which includes Atlantic Highlands, Leonardo, Belford. They had fallen into the highest grouping for colorectal cancer and breast cancer incidence. So we wanted to take a look at racial or ethnic breakdowns of these areas based on the feedback we received in the first meeting. So that's what we've done. We're using this census tract data to do the same thing. So here is that area, right? It looks almost similar to this one. Like I said, sometimes they track pretty cleanly with the census tracts, these population areas. So this one actually is pretty similar right here. So what we see from this plot is that largely white non-Hispanic population in this area, we're really not picking up any, instance of color on any of the racial or ethnic minority plots. So, interesting to see that an area with just largely white non-Hispanic persons would have high cancer incidence rates here. Breast cancer does tend to affect white and Black women more so than Hispanic and Asian women in New Jersey as a whole. But, we just wanted to take a look at the racial ethnic breakdowns in case there was anything we could do for specific types of outreach, especially like if we needed, Spanish language translations or, outreach materials that align better with Black or African American populations. These are the kind of things you could see when you look at the populations based off these high incidence areas. So the second one we looked at was in Neptune. So this is the area north of Asbury Ave. It's south of Shark River Park and in between the Parkway and Route 18, if anyone's familiar with those areas. Again, this area falls into the highest quintile or grouping for both colorectal and breast cancers. It also ranks high on the area deprivation index scale, which I will show a little later on. So we wanted to look at the breakdown here. And again, so this one will actually be split into 2 census tracts. We'll see it here. It is these two, where my pointer is right here. These are the 2 census tracts that make up that population area that we see on the previous slide. So what we see is that these census tracts are, so since they're split, one of them all the way to the left, which is the, the one closer to this, I think that's the Parkway right there, is 30% Black or African American. And then the one right here, which is adjacent to it, is about 50% Black or African American. And then you could see as we move towards the coast, these census tracts become less white non-Hispanic and have more racial or ethnic minorities. And you can see that on the white non-Hispanic map a little cleaner, whereas like towards the coast here, especially like moving from Neptune into Asbury Park, these areas are, largely racial or ethnic minorities. I think these 3 census tracts right here are, over 95% combined Black or African American or Hispanic, Latino. And the last one we looked at, which was an interesting case, was Lakewood. And I know you recently did an outreach event in Lakewood as well. So this, what I find interesting about this is that a lot of the areas here have no data related to it. So we only have this one, 5,000 person population grouping here. And then on the breast cancer map, we have this other one here that has data included, but most of these areas don't have anything, when areas which are less populated around it actually have reported numbers, which is unique to me. But we found that, this area of Lakewood actually had the highest breast cancer incidence rate of any 5,000 person population area in the state. It was 447 cases per 100,000. Putting that into perspective, I know we mentioned last time the state rate during this time for breast cancer was only 137.6, and the Ocean County rate was 134.7. So you're looking at almost, a 3+ times incidence rate for this specific area of Lakewood for breast cancer. And they also fell into the highest grouping for colorectal cancer as well. And then I also actually took a look at lung cancer across the state just to see if any of these areas aligned as well. And funnily enough, I guess not so funny, but what stands out is that this area also had the highest lung cancer incidence out of any 5,000 person population area in the state, and also fell into the highest grouping for prostate cancer incidence. So this little strip here of Lakewood seems to, be a problem area for cancer. And when we look at it on our census tract population maps, we see again, this is largely a white non-Hispanic area. We have, the census tract here and the adjacent one have about 1,800 and 3,500 Spanish-speaking persons based on the census tract data that we looked at. But we know, majority, we see this white population being in darker color, right? So there's a large Jewish Orthodox population in Lakewood. And we mentioned last time briefly, but I wanted to just get some, stronger numbers for this presentation. There's high risk in Ashkenazi Jewish, which is Eastern European Jewish ancestry, which stems from a propensity to carry breast cancer 1 or breast cancer 2 gene mutations, which are sometimes called BRCA or BRCA2 mutations. If you have any, experience with hereditary cancers, it's a fairly common, term for breast cancers, especially when we're looking at getting screened earlier for cancers and things like that. If you have a family mutation that gets passed down or is within your family, that, you might be at higher risk and need to get screened earlier or more frequently for breast cancers. So since these mutations run pretty high and, well, I should say very high in Ashkenazi Jewish heritage, about 1 in 40 persons will carry this mutation compared to the general population in the United States, where it's 1 in 400. So 10 times as likely to carry this gene mutation, which puts you at a substantially increased risk for not just breast cancer, but also ovarian cancer in women, and also melanoma and pancreatic cancer and prostate cancer for men, as well as male breast cancer. So, largely any male breast cancer a lot of the times is hereditary in nature, but, they name these genes the breast cancer genes, but they're not just, affecting breast cancer. They also have a large effect on other cancer risk as well, which could be, a reason why this area has such high risk for cancer. So we focused on like cancer incidence rates, but I wanted to take a little bit of a look into, social vulnerability, things like that, area deprivation index, and see if any of these areas align with, some of these metrics as well. So this is the CDC's social vulnerability index, which kind of combines metrics from 4 different, social health determinants, including poverty, education, language, housing, and transportation. And a lot of these areas do align with what we see of those high cancer areas, especially here in Lakewood. Down here, we see it's, in the highest grouping of social vulnerability. This is that area right here where the pointer is in Neptune and moving into Asbury Park. Again, popping off with the darker blues on the color here. And then we have other areas of Ocean and Monmouth County that, we'll see on the population maps that I'm going to show are, largely racial ethnic minorities as well. So we have this area of Freehold over here. We have this little southwestern part of Red Bank, which is a big Mexican American community, and then these areas of Long Branch, kind of in the middle of the city, like by Route 36 and Broadway, and those areas, kind of where if anyone's familiar with where the Monmouth, I think they have an FQHC over on Broadway over there. I think it's right in that neighborhood, as a matter of fact. And this is the area deprivation index, which I mentioned. So this is similar to the social vulnerability index. It's broken down into census blocks, which is smaller than census tracts, which is why it looks a little more muddled on this map. But it also factors in things like access to healthcare and access to general, necessities, along with those social determinants. So again, some of the same areas really pop off with the darker reds here, which would be a higher area deprivation index. We have areas of Neptune, again, Lakewood, Long Branch, Asbury Park, Red Bank, and Freehold, which are some of the highest ADI census blocks in the region for Ocean and Monmouth counties. So I don't want to get too deep into the area deprivation index because those areas are pretty small, and we can talk a lot about, the neighborhood intricacies of the area deprivation, but we do have this available on our STRIDE dashboard, which is like an all-encompassing catchment area dashboard. It includes incidence and mortality maps, trends, screening rates, and behavioral risk factors by county. For New Jersey, you can filter by race, by gender, things like that. It also includes the area deprivation index maps of environmental risk and public transportation mapping. So it's pretty interesting. The link is in here. So when we send the slides out, you should be able to just click it and take a look. And if you have any questions about it, feel free to let me know. We can always add things if you're interested as well. So again, we talked about, cancer cases earlier, but to expand a little for this presentation, and if I'm running over in time, please feel free to just let me know. But these are my last 2 slides. These are screening rates. So again, this is from that CDC Environmental Public Health Tracker. So I took a look at a few of the screening rates, and these are 2 that kind of jumped out to me for having similar screening rates, low screening rates in specific areas that really just stood out on this map for me, right? So this is the social vulnerability index map. Again, we have these areas of Freehold, Red Bank, Long Branch, Neptune, Asbury, Lakewood, things like areas like that within Ocean and Monmouth counties that rank high in social vulnerability, as well as, high for racial or ethnic minorities, right? So these are those areas. The lighter the color means the screening rate's lower. So again, we have this southwestern part of Red Bank here, right? And the lowest grouping for colorectal cancer screening rates, for cervical cancer screening rates. We have these areas down in Long Branch, again, same thing, lowest, right, for colorectal, cervical cancer screening rates. Back here into Neptune and Asbury Park, these 2 little, kind of yin-yang looking ones down here with really high racial ethnic minorities, again, high on the social vulnerability index, and also very low screening rates. So it's interesting to see that those areas do have low screening rates, which means that there's obviously room to, provide outreach to those areas for specific cancer screenings, especially for preventable cancers like colorectal cancer and cervical cancer. And this is just that census tract population map to, really hammer home the point of who's living in these areas, right? Who are the ones who are vulnerable according to the social vulnerability and area deprivation index, and then kind of confirmed by the low screening rates. Like these are the areas that we need to be reaching. specifically with, targeted outreach. I think as, someone who formerly worked in outreach, I think it's important to tailor your outreach to those communities specifically so that they connect with what you're doing. But I just wanted to hammer home those points. Those are some new things that I saw since last meeting, just building upon, looking at high risk cancer areas in Ocean and Monmouth counties. And then again, we'll have these links available. So a lot of the data comes from public sources. So you can, use any of these links. And if you need any assistance navigating the sites, or you want to know a little bit more, feel free to reach out and I can always answer any questions for you. But that's all I've got for today.
Thank you so much, Dan. Building upon the last presentation is definitely helpful here. We see a lot of the same things in a lot of the same towns. So to me, from what I'm hearing from you, is that like there's lots of opportunity for us to do outreach together, collaborative events, and making sure people know that there are screenings available. There are ways to try and control and prevent this data from getting any worse. But the links, if you go back one slide, the links there are really helpful to us, not only to create outreach events and different things like events, initiatives in the community, but when we're grant writing to obtain more funds for the great work that we're all doing. So again, thank you, Dan, for helping us and getting us familiar with this and providing it all in one nice little package. So we appreciate you being with us.
Yeah, my pleasure. If anyone has questions, again, feel free to email me or shoot me a chat while I'm still on here.
Yeah, does anybody have questions for Dan? Or even, Dan's going to be with us regularly on these meetings to provide these types of presentations. If there's a specific focus that you would like to hear from him in relation to the data, please feel free to let us know. You take yourself off mute or put it in the chat.
All right. I did have a quick question, Jenna. Dan, when you showed us the picture of Lakewood and you said that this one section, you had data, right around the time you mentioned about the Ashkenazi and the gene pool, or that mutation that you had mentioned. Yeah, right there. How were you able to focus on that one section and know that your data came from there, and not from the other surrounding areas? Curious.
So you're talking about how I knew that the incidents came from here?
Specific to that, yeah.
Well, this is just highlighted on this map here, right? So these gray areas just indicate that there's no data available from that spot. And this blue here and this orange are in the highest realm. So when you're on this website, you can click on the area and it'll pop up and give you a little bit more data about it.
Okay. Do you know if the gray area is a whole different population? Because you know how in Lakewood, you have your sections and then you have these wider areas where there's mostly Latinos, there's a Black population or a Black neighborhood. That section that you showed, is that the Jewish neighborhood? I'm trying to see.
So I'm not as familiar with the actual geography of Lakewood, right? I'm just looking at it on this map, but I appreciate the insight there because this is the population by census tract. So these are percentages, right? So this down in the bottom left is Hispanic or Latino population. So these are generally anywhere from I think this whole area really sits between 14 and 20% for those specific areas. This one right here is the one that was kind of jumping out on the map, right? Obviously, we don't have, based on the last one, we don't have the information for these other areas, right? So this area right here, that's gray, this large area is the one that has the highest percentage of Spanish speaking persons, but we don't see it on here, right? We see it here. It's this big one that is the darkest on that, but we're missing data. So that's why I said it's a curious case for me, why all this Lakewood data is just not there.
Yeah.
It doesn't make sense with a city of 125, 30,000 people. It just doesn't make sense.
That says to me, we need some more education and awareness around the Hasidic community and their preferences about being screened and what they're able to do versus what they're not able to do. Because, I know that there are certain sensitivities in relation to the medical care that they receive. Yeah. Go ahead, Edgar, you have a question.
Yeah, I was gonna ask, I remember one of the first few slides that you presented, it had the graph had a a downward trend. I believe it was mortality rates, yes. Can we assume that those rates has gone down due to maybe like the overall like increase in screenings throughout the years? Or is there another like reason to that?
Yeah, in general, mortality rates have gone down just as treatments get better, early
Okay.
detection improves. Yeah, it's things like that. So like a lot of times you will see incidence rates, right? Like incidence rates going up. Sometimes that doesn't necessarily mean that cancer is a, it's like everyone has cancer, right? Sometimes it means that you're getting detected early in that area. So you'd have to break it down by, you can look deeper, and I'm sure folks at the cancer registry are able to do this, like this staging of the disease, right? So if you're catching all these cancers, but they're stage, they're early stage disease, that's why your mortality rates would be, lower comparatively speaking to your incidence rates. As an assumption, right? I don't have any science backing this. We're just having a conversation about it. But yeah, just from, my work with, people who are treating the disease and epidemiologists, that's what I've, gathered from that.
Right, right. And then another question I had was, is there data available where it kind of shows like the different age groups? Because I wonder if like, and I'm speaking more specifically about like the Hispanic population, or like is there the known like Hispanic paradox where like, the where the Hispanic people who are born within the states, are more um are more at risk for like chronic diseases than those who have migrated and are immigrants. I wonder if that kind of plays a role also when it comes to looking at like cancer overall.
Yeah,
I don't know if that's something you guys look at.
the state registry has groupings of 10-year for cancer incidence and mortality rates. A lot of times, again, that they'll be suppressed because there are so few cases within specific age groups. So like it's hard a lot of times to get, incidence rates for 20 to 30 or 30 to 40
Right.
for specific racial or ethnic groups, especially non-whites persons in New Jersey, just because a lot of times the data it's not enough to be accurate or to provide confidentiality. So they do exist. I'm sure analyses could be done on that just based off of what I know, how cancers are reported to the registry. Like obviously age is available. So, things like we've looked at it from within our own health system, but I couldn't make an assumption about, statewide
Right.
Hispanic or Latino persons just based off of our own health system. We'd have to look at the entire state. But yeah, I get what you're saying. Yeah, for sure. We do see like some cases, and especially for I think like colorectal cancer is one that tends to pop up a little bit earlier for Hispanic and Black persons in New Jersey.
Thank you.
Yeah, great question.
Does anybody else have another question for Dan? Dan, before Bridget popped off, she just asked, can you share these stats? So the answer to that question is yes. Dan will give us the presentation afterwards, and when I send out the minutes, it will be as an attachment with the minutes.
Thank you, everyone.
Thank you, Dan. We're so appreciative that you're able to be with us, and we're looking forward to the next one. I made some notes about future interests, and we can connect offline.
Cool. Thank you.
All right. Thanks so much. All righty. Can I share screen, Dan?
Yep.
Let's see.
Should be good.
Okay, excellent. Next up on the agenda is our director, Natasha Davis. And if I could get my act together, we are going to join together to wish Natasha a happy birthday. She's with us today. And I can't believe she's working on her birthday, but at the same time, I very well can. So happy birthday to Natasha. Welcome. Thanks for being with us. And you're at the next agenda item to talk about state updates.
Well, no, thank you very much, everybody. And my apologies for being late this morning. I did not want to hold the meeting up as my first meeting ran over a little bit. So I will be briefly here because I don't have too many state updates, but the biggest one is that the state of New Jersey was awarded an additional $1.5 million in funding towards cancer and chronic disease efforts. So primarily, the bulk of this funding will be going to a lot of the NJC programs throughout the state. We are not sure how much funding every site is going to get. and we are not sure what the conditions are for this funding. I was told that this funding is primarily going to be for screening, so I know they're going to be expanding our scope, expanding our targets. I expressed that we're currently in the need of more funding towards personnel. As you can see, Jenna and Marlene have been doing an awesome job, and Diana have been doing an awesome job with the coalition, but we need more help. We are severely underfunded. Our funding was cut, so I was expressing a lot of these same sentiments to the state. So there may be times where we will be calling upon your behalf for the coalition just to kind of stand with us as we are seeking funding for our personnel so that we can continue to build up our coalition and provide more of the robust services that we're doing with all of our great partners that we have on the call. So thank you very much there. Right now, we're just kind of in the waiting stage, really, with DOH. There's a lot of new health equity components that are coming out. So you are going to start hearing about other services that we are offering in ways we're trying to enhance some of our partner sites' electronic health record systems. So we're going to be implementing a core health needs screening questionnaire at some of our FQHC sites. So this will help us to better identify patients who are experiencing different barriers and health inequities, and if they, really just addresses the social determinants of health, so that way we can extrapolate this data, we can create evidence-based programming around the needs of what the community is telling us that they need. So whether it is transportation, which is great, we are addressing that now, but if it is, someone having difficulties with their finances or doing a budget or employment or any food insecurities, we want to hear from our patients from all of our sites. So this is going to be a new initiative we're hoping to roll out to have finalized this quarter and then fully implemented at the top of the year. But again, thank you, everybody. Jenna, that was really all the updates that I have. If anybody has any additional questions, I'll still drop my information in the chat, and I will just keep you posted as things progress along.
Thanks, Tosh, and happy birthday again. We appreciate you being with us on your day.
So thank you for the birthday wishes, everyone, and for the infographic. It was really nice. Thank you.
Yeah, of course. So we've thrown a lot of really good information at you thus far in the meeting, but now is really the time that we open it up and ask our community partners to share with us the great things that you all have going on. So I'm going to stop sharing my screen. And I will open up the floor. I want to read something that Peter Curotalo from the Ocean County Health Department had sent to me about his update. He had to jump off, but he asked if I could give you guys some information. So I'll say that, and then I won't say anything else. He says, Ocean County Health Department, the Community Health Services Division has completed and shared our official Community Health Needs Assessment Survey. The CHNA will determine the most pressing 5 issues for our county, Ocean County, over the next 4 years. The survey will be sent out to me, Jenna, to share with the partners, and it's a required part of public health practice standards. So it only works if the people take the survey and rank the issues that make the efforts to be focused on. So what I'll do is I'll share that when Pete sends it to me. And we'll ask that you all can participate if you serve families or work or live or participate in activities in Ocean County. So that's the Ocean County Health Department update. And I'll open up the floor now to anybody who would like to give an update. Maybe Seed, does Seed have anything to share? Raven, Charisse, Ebony.
Hey, Jenna. Hi, everybody. This is Raven from the Seed program. You mentioned our event that we have on November 5th. As we were talking about the film, we have that upcoming. We are still in the process of confirming some mammogram dates for free mammograms with some of our partners. We just had about, I want to say like 8 to 10 events in the month of October to provide free mammograms. So we were really, really busy this month, and we had a lot of great outreach events. So we're in the process of confirming some dates for the end of this year as well for 2023. So once I get that information, I'll be able to send that out to you to let everybody know what's going on with Seed and how they can be a part in sharing our information and getting these resources out to the community. And also, I like the data that was shared today. I was taking screenshots of it because it will help us even in our outreach efforts. So thank you for that today. But that's all I have from Seed.
Awesome. Thank you, Raven. Somebody has asked about the transportation. So maybe Diana, do you want to take a quick minute and provide some insight about what we have going on with transportation efforts?
Absolutely. So we have two grants. We have the SEED grant, which that's part of the SEED, that is to provide transportation for those folks that are registered with us and want to go get their screenings, whether it be the prostate, colorectal, cervical, or breast cancer screenings. We provide free transportation round trip. I want to emphasize that because I say that and they go, just one way? And I go, no, we'll send you, we'll bring you back and bring you back home. Round trip transportation to whatever hospital site or campus that you are registered or have your appointment for your screenings. We do use Uber for the transportation. And then the second one is just a transportation grant that we were offered from the state that is to help those that are have chronic diseases or survivors of cancer and are going through cancer treatment, as well as COVID. Or want to get tested for COVID. And this grant is a little bit more flexible because it helps those in need that are need that transportation, but you know, the local county transportation, like I think it's Scan or Ocean Ride, they just fall between the cracks, you know, like they have limited times. You can only have the ride within a 2-hour period, you know, for 2 hours. This grant provides that transportation for folks that need to get to, let's say, pick up a prescription, or they have to get an early appointment in to the doctors, but they have to stay there for a while and, you know, 5-6 hours, and they can't get a ride back. So that transportation, while that grant is a little smaller, we do try to spread that help around in Ocean and Monmouth County. There's no limit. So if there's someone that is in need to go to, let's say, from Ocean County all the way up to Middlesex County for New Brunswick to RWJ, we can help that. There's no limit in terms of distance. And I think that's been a great help for a lot of people. I get positive feedback on that support on that grant. So if you know anyone or you want to let people know, I can certainly forward the flyer, which we have, out to you guys. So you can post it out and let people know about these programs that we're offering transportation. And I'll say one more thing, and then I'll get off my soapbox, folks. Transportation, and I think most of the people here who are that work in cancer, transportation is a major, major issue for folks that are either being treated or survivors. It's just so hard for them to drive after they've been gone through the treatment, or hard to find help to take them to these treatment appointments or oncology appointments. So I think that's something that I think the state is beginning to recognize because they gave us this grant, but it would be great if we could get more support on that, because I've been noticing a trend that transportation is the biggest obstacle that they have when they're going through it. And then I'll get off my soapbox and that's it. So I'm the contact for it, by the way. I put my contact information at the beginning, but I can put it down here again. If you know anyone, just send it to me. And, you know, their information and their phone number, and I can certainly help them with transportation.
And Diana, Natasha threw like a quick summary of what you just said, and as well as your information in the chat box for everybody. And then we will forward that flyer. We have one small little minor update to make to the existing flyer, as the state has outlined some changes for us financially. And we want to reflect those appropriately in the flyer, and we will share with this group with the minutes. Thank you, Diana. Okay, any of our cancer centers or hospital systems that want to give an update? Any of our,
I'm sorry.
That's
Jenna,
okay.
I can wait. Kathy. Okay. Hi, everyone. Good to see a great presentation so far. I'm from Cancer Care, and I just want to remind everybody that as Diana said, transportation is a big need. And with our Hope Line, which is a national Hope Line, most of our calls are for financial assistance. And we do have financial assistance that can help patients get to their for treatment. They have to be in active treatment. That being said, we have various other grants. They come and go, as you all know, but we do have pretty consistent grants. I believe we just got something. We have a bladder grant too, because I know that was mentioned. So I would encourage people to call our Hope line, which is 1-800-813-HOPE. And one other thing, we have what we call resource navigators. They used to be called case managers. We've just recently changed that. And those resource navigators really help patients find resources in their communities. That's a national line. Again, you can access that through calling our Hope line. And I would encourage people to go to our website. We have a lot of wonderful programs, education programs, workshops, publications. And we also have a new, it's been around several months now, but a time to screen that is a telephone line that we have now where people can call if they're looking for a place where they can go for screening. So our workers will navigate that for them too. And that can be found on our website, timetoscreen.org.
Timetoscreen.org, Kathy?
Yes.
Is it a TO or a number 2?
TO. Okay. And the number is 1-855-53-SCREEN, SCREEN.
Okay. Excellent. Thank you for that update.
You're welcome.
I just got a message. Gina, do you have from Horizon any updates that you want to share? I know you have to pop off just a little early.
No major updates, but thank you. I'm just as a friendly reminder, I apologize for my camera being off. It's been acting funky. At Horizon NJ Health, we're here to help assist with New Jersey family care enrollment for your clients. We love collaborating with community events, especially food security, anything that really addresses the social determinants of health, and also providing free health education across the state. Thank you.
Excellent. Thank you, Gina. And I got your message about collaborating on some events in 2023. Let's definitely do it. We love working with you guys.
Perfect. Awesome.
Okay. Thank you. Any of our CHCs or our federally qualified health centers that want to give an update? Everyone's quiet today. Okay. Anybody else? I'll just open the floor. Feel free to take yourself off mute or write it in the chat. No. Okay. Any questions from the team about anything that we discussed today?
Jenna, Carmen quickly asked if we could write the information about the Hope line and time to screen again. I mean, I can type it in there.
Yeah, I have the Hope line.
Screen.
Hope line. And then it's the time to, yeah, if you could do that one, Diana, that would be great.
Mm-hmm.
Awesome. Thank you.
All right.
Okay, so if you don't have any major updates to share today, or maybe you're in a position where you can't take yourself off mute and share, but you would like to send something out with the meeting minutes, being as you're here today and you're a coalition member and partner, we'd love to always share your events through our meeting minutes on our Facebook pages, through our e-blast and newsletter systems. So I'm going to ask that if you have anything, that you please send it over to me so that we can get it out to share with everybody. And then the other thing I would like to do is to share with you all our, oh dear, the word escapes me, our survey. If you wouldn't mind taking our survey, I'm gonna just pop it into the chat box to let us know how we're doing in the community, not just for this meeting, but for the events and initiatives, the collaboratives that we do with many of you. We're always looking for ways to improve. We want to hear your ideas or ways that you feel we can work together. So I just put that survey into the chat. It's in English and in Spanish. It should take you no longer than 5 or less minutes to complete. So it'd be greatly appreciated. And I'll just ask any last words from any of our team, OMHA, SEED, or HER. staffers before we hop off? No. Okay, looks like we're ending a little early today. The next meeting like this will be in February, so I can't believe it, but we're going to say, you know, we'll see each other then, and I'm sure we'll see each other before. Have a great day, everybody. Take care.
Yeah, and happy Thanksgiving, everyone.
Yeah, enjoy the holidays.
Happy Thanksgiving.